Hi, I was diagnosed with a multinodule goiter, and I wanted to take a moment to share my journey with those who may be trying to make some very difficult medical decisions. My journey began in April 2011. I went into my primary care physician's office for a routine physical, had a series of blood work. It wasn't until my blood work came back and my TSH levels, and that stands for thyroid stimulating hormone levels, were low. In 2011, my thyroid stimulating hormone levels were 0.11 on a scale of a range that they look at from 0.35 to a 5.0, and sometimes that scale may vary. But I had had symptoms for many years and had discussed those symptoms with my primary care physician for many years. So finally, I had potentially some explanation as to why I continue to experience some of the symptoms that were directly associated with hyperthyroidism. After talking to my physician, she had determined that my levels were not low enough to warrant further treatment. And at that point, I definitely pushed back. I had suffered with symptoms for years, and I really believed, although I had a limited frame of reference for thyroid disease, but after doing some research and reading, I truly believe that some of my symptoms were directly related to my thyroid and to the TSH levels. So after a number of conversations and office visits with my primary care physician, I decided to seek a second opinion. Sought a second opinion from another primary care physician who ran the same series of tests, with the results coming back still with me being having hyperthyroidism. At that point, my levels had dropped from a 0.18 to 0.11. It was at that point that my primary care physician recommended that I speak with an endocrinologist. I met with an endocrinologist, although I have to tell you that as a new patient, it took me 4 months to get an appointment to see the endocrinologist. And unfortunately, and shame on me, that I was unable to make that appointment. I called and rescheduled, and of course, the next available appointment was almost 4 more months out. So I should have made arrangements to reorganize my schedule and to do whatever I had to do to get into that first appointment. I also could have asked my physician if she would have been willing to place a phone call to the doctor's office, to the specialist office, to see if I could be seen before that first 4-month appointment as well. So a number of things. In hindsight, I realized that I definitely should have done differently. So met with the endocrinologist, had a series of tests that were performed, uptake and scan, ultrasound, as well as a fine needle aspiration. Unfortunately, the fine needle aspiration did not render any results that could determine whether or not I had cancerous nodules. So based on that information, I had been diagnosed with hyperthyroidism, had multinodule goiter, which my thyroid was enlarged. I had hot and cold nodules on both sides, on the left and right side. And given that information and lack of information about whether or not any of them were cancerous or not, I was referred to a surgeon. I went to see the surgeon for a consult, and immediately knew leaving the surgeon's office that I would seek a second opinion. And the reason for that is that the surgeon that I spoke with was not familiar with my case. He talked to me in very general terms about what this procedure could look like, and I needed someone who could talk to me about what my procedure would look like. And not only that, I needed someone to have a genuine concern, have the ability to communicate not only with me, but with my family post-surgery, and to be able to calm their fears as well. So those things were very important to me, and I knew that I needed a second opinion. And thank God for that. I was able to find a phenomenal surgeon and staff, the nursing staff. I mean, everyone was truly exceptional and had a patient-centered and family-centered care at the top of their list. And so that experience was absolutely a blessing, and being able to have someone that had that level of wherewithal and genuine concern for me as a patient, but then also for my family, was just exactly what I needed and what I was looking for. So fast forward to surgery. It was determined with talking with my surgeon, of course, that we both agreed that a thyroidectomy would be the appropriate course of action, given that my thyroid was enlarged, had multiple nodules. We weren't sure what was going on with those nodules. During surgery, they did biopsy some of the nodules, sent them up to pathology, just to ensure that if he had to do further exploratory surgery or any type of additional removal, he could do it at that time. Past surgery into recovery, my level of pain, I remember it being from moderate to severe, although the facility had a wonderful pain management control staff, and so that lasted maybe less than 24 hours in terms of the level of pain that I experienced post-surgery. I was slated to be in the hospital for 2 days. My stay actually was for 3 because I did have a drainage tube, and my surgeon we had talked, and he definitely was not a supporter of sending patients home with a drainage tube, and I supported that decision as well. So I had surgery on Tuesday, and was discharged on Friday. So I was in the hospital for 3 days. Post-surgery and recovery at home has been fairly uneventful. My pain levels really are pretty low to moderate. I have more fatigue and just tiredness than anything else. I did have a bout with bronchial inflammation, which caused me to cough and sneeze persistently for almost 2 days, and that was painful. But I was able to have a cough syrup called in, and that definitely has helped significantly with the inflammation, which can sometimes be a direct result of having the breathing tube inserted during surgery. In terms of my incision is doing great. I had my first follow-up appointment 1 week post-surgery this week, and it's healing great. I do have a tendency to keloid, so my surgeon did sutures inside the wound and then glue on the outside of the incision. And so it looks a little thick right now, but once the glue starts to come off, which it already has a little, it should actually heal fairly well. So I'm not having too many challenges with the wound. I do clean it with alcohol, not directly on the wound, but above and below the wound and around my neck area to try to keep that cleansed. And definitely don't shower because I don't want to get the incision wet, but I do. You are able to take baths and just not get any water on the wound at this point. In terms of takeaways that I could leave you with for those that are trying to make decisions, I would simply say research, and more research. Do your due diligence to ensure that you do have the best frame of reference when you're talking to surgeons and to physicians. It does empower you when you can go in having a frame of reference and really understanding what they are communicating with you. And then also take someone with you. That's always a good general rule of thumb in any type of medical situation, because sometimes we're receiving so much information, and it can be extremely overwhelming, and it's fearful sometimes when someone's telling you something, and we're not sure what exactly they're communicating and what the outcome could be. So take someone else with you and be able to have those conversations with that individual or those individuals at a later time to ensure that you received all of the information that was being communicated. And also, my number one rule of thumb, I have a couple of them, but would be to not leave a doctor's office not understanding, or a surgeon's office not understanding the information that was just communicated. If you have to seek a second opinion, seek a second opinion, but make sure that people are not dismissing your concerns or putting you in a pool of all of these other people that perhaps they've provided services for, because your case is your case. You're an individual. You deserve to have answers to the questions that you have concerning your health. So become an advocate for yourself, and find someone that will advocate for you and your family as well. Seek out services that not only support you pre-surgery and during the surgery, but then also, afterwards, when you're at home and you're recovering, find resources and support services that provide ancillary services, because this is something that we have to work on maintaining. There's things that we have to do. We have to exercise. We have to be very diligent about the types of foods that we eat. So nutrition, health, and wellness, those are all very important and key components to ensuring that we remain healthy post-surgery. And then second, I would just simply say, just make sure that you have all of the information that you need, and that you feel comfortable and confident with the surgeon and the physicians that you're speaking with, and that you truly have a peace of mind with working with these individuals, and truly believing that they do have your best interest at heart. There are some phenomenal doctors and surgeons that are out here, and not everything works or every person works for everybody, but it's very important that you find the best fit for you and your family. So I thank you for joining me on my journey and hearing my story. I hope that I've been able to provide you with greater insight and also comfort in knowing that this is not something that is not treatable. Is it a transition? Is it a process? Absolutely. Does it require patience? Absolutely. But this is also something that we should be aware of, and we should work diligently to increase awareness. I have always felt pretty well versed in terms of, my body. And when I saw that TSH level, I did not have a clue what that actually meant, what it controlled, and how it had affected my life for many, many years, functioning at higher levels. And so increasing awareness, and I also did not realize that there is hyperthyroidism and hypothyroidism. There is some hereditary traits that are involved in this. Out of all the ailments that my family has, I did not have a clue. My mother, my grandmother, my great-grandmother, my great-great-grandmothers, my aunts, we have never talked about hyperthyroidism or hypothyroidism or the thyroid in general in our family. So I don't know if any members in my family have ever had thyroid disease. Just because they weren't diagnosed with it or never talked about it doesn't mean that it wasn't so. So increasing awareness and talking to our kids, our sisters. The first thing I did was call my sister. I called my daughter. Talking to our family members about thyroidism and making sure that they are being checked for thyroidism is very important. So thank you, and God bless you on your journey. And I'm sure that with research and support and a really good staff of doctors and surgeons, that you will have a successful journey as well. God bless you. Thank you.